couple of things before we get started. We're going to have presentations by everybody who's been working on this program. And one of Al's favorite lines that he got from the book that we're going to plug is, "It's the women after all." And that's what this class has been about, is the women who are made to carry future generations, and how we think about that and how we move on with that information and that thought. There are so many pieces of art with the Madonna and Child. I mean, clearly that is an inspirational image for the ages, and we never stop making those images in art. I found this photograph of a woman holding an infant in Appalachia, and you can see the home she lives in and the sort of scrubby environment, but there she is, mother and child. And then this one, I want to explain, if you can see it. Can everybody sort of see it?
Yeah.
This is from our trip to Montgomery, Alabama, where we got to meet the artist, Michelle Browder, who's a sculptress in metal and found things. She uses all these found things, and she has created a sculpture garden of 3 women who back in, I can't remember exactly when it was, early 20th century, I think, Black women were used as guinea pigs for his medical experiments. Enough said, right? And their bodies were horrifically transformed by that, and their lives were changed. And she is honoring them with this sculpture. And she's also trying to create in Montgomery a clinic for women who need reproductive health care. So, and I'm gonna, okay. So this is sort of a review. Nick's gonna give us a review of the class, but these are some of the words. We call it a word cloud. And you can just look at all these different words that have come up, and these are just a few of the words. We've got images and we've got words. And I wanted to remind everybody of what Brian Stevenson said to us when he spoke in November about the value in terms of any kind of justice and relationship with our fellow human beings, proximity and listening, changing the narrative, hope, and a willingness to be uncomfortable at times with what we learn and where we go in the world to try to do the work that I would say Jesus claims that we should be doing. So.
Morning, everyone. Nick Lee, I have worked with Leslie and Al to help kind of coordinate and plan these sessions of classes, and kind of excited to just really more MC our session today as we kind of explore what next, what can we do now. We have 6 weeks, with today being the 6th week, where we've kind of gone through women's health care, the infant mortality rates in Georgia, the gaps in care, the differences between Black individuals in our communities and whites, and the negative implications of that. And even this morning, there's in the AJC an article on the front page about maternity care and the challenges that are being made in our health system by the closing of the Atlanta Medical Center. For those that were in the 9 a.m., you may be familiar with Pastor Andrew's sermon. The other thing on the front page is about GPT. If you're in the 11 o'clock, you'll hear more about this later. So the AJC today is speaking to Trinity Presbyterian Church. Both articles are very thoroughly covered here. I did want to just kind of start. How many folks have been to all 6 classes, either virtually or in person? Wow, that's a great turnout. I can't even hold my hand up. I unfortunately had to miss Dr. Peter Barrett and John Tyrrell's session, which I hear was fabulous. But I did want to kind of recap for those that couldn't have gone through kind of my takeaways for the weeks. Our first week, we had Dr. Al Brand speaking to us, really kind of sharing his amazing background and how he's worked in conjunction with many other people to shed light on the maternal mortality crisis that exists, especially here within Georgia. And I think all of us that were participating in that session remember Al's 4 questions, and we're going to ask him again to come up and ask them later today, because I think it's a great way to set it. In our second week, we had Dr. Lewis, who spoke to us about the role of the Georgia Trinity Mortality Committee. My big takeaway from that was in the 2012 to 2017 review, they discovered that 75% of the prenatal mortalities or infant mortalities that they reviewed were potentially preventable. Had the right access to care, medical treatment, addressing comorbidities existed, which is really kind of a shockingly high number. Week 3, we had Dr. Vita Johnson, who said, and I quote her in this, "Every young person deserves to succeed, and every adult is responsible for making that happen." And I'll say that one more time. She said it twice. I think it was great. Every young person deserves to succeed, and every adult is responsible for making that happen. And so a lot of what we'll be talking about today is how we do that, how we as a community can help those around us that need to have better chances to succeed. Her 5 things that were key were safe space, effective education, healthy start, a caring adult, not necessarily a caregiver or parent, just a caring adult, and the opportunity to succeed. In week 4, Dr. Peter Barrett and John Tyrrell had stories from the other side. I was not able to participate in that session, but after hearing many of Peter's fabulous stories, both as an OBGYN here in Piedmont, as well as his time in Haiti, really kind of sharing, I think, difficult stories and experiences that he's dealt with in terms of women's health care and child mortality, but also hope and the hope that can exist even in some of the most desolate and barren places like Haiti. I think hope is important because when we get into the 12 bullet points in the document, the 12 steps to overcome these disparities, hope is an essential component, an essential ingredient. And last week, Dr. Ian Dunlap showed us that the data was very clear that Georgia's fetal infant mortality rate is in largest part attributed to women's health and maternal care. And that care needs to be pre-contraception and inter-conceptions. So as you look at that lineup, I realize I'm wildly underqualified to be standing up here this morning. I have not received the necessary medical education, I believe, to participate. But really, I want to kind of just jump into what the 12 steps. I will again call, if I were doing this in the appropriate way Jesus wanted me to do it, I would Socratically call out individuals to announce to me what's the first step in the document that Dr. Brand provided to us. How many folks have actually read the 12-step document that we have referenced many, many times? Okay, pretty good numbers. It's a great read and it's a good homework assignment for those that haven't, but just, I did want to kind of share all 12 steps proposed because I think they do give us good guidance as far as what can we do. And I think a lot of times the questions at the end of all of the sessions over the last 5 weeks has been, okay, so what? I think we can all that have participated in this acknowledge there is a problem. How do we address it? And it's not an easy thing to accomplish. We have really the 12 steps are broken down in kind of 3 chunks or subsections. Steps 1 through 4, which I'm not going to read, but are up on the screen, is about improving healthcare for African American women. I will say, as a group here, as a Trinity Presbyterian community and church community, these are probably the most challenging ones for us to actually implement and leverage care. But we do have members within our group who are doing things, and we actually have Shannon Zale who will be speaking somewhat about ways that the Grady Health System is trying to address these shortly. The second tranche of steps is focused on strengthening the African American families and communities. We have a number of great organizations that we are already partnering with as a community, as a church, that we can continue to do to help support and build on steps 5 through 8. And then steps 9 through 12 is really just addressing the underlying social and economic inequities. When I was reading this document and I got to step 12, it kind of made me pause, because that's a big one. And I did find in reading the document that the number of things that we had to do to succeed and address this disparity were great, but I do think that that's where we get back to the importance of hope. So I do, as kind of our first person, I'm going to, again, my role more is going to be as an MC, speaking through ways that we can make a difference, we can make an impact as a church and a community, is to kind of call on some of the other members to help us pull together ways that we can do that. And I do want to introduce Shannon Sale, who I think is Chief Strategy Officer of the Grady Health System. She was just really a casual observer of this class, but felt very strongly that the work that they're doing at Grady is a very significant connection to what we're doing here in this class. So.
Good morning, everyone.
Good morning.
I'm glad to go over some of the programs and have had obviously the pleasure of working with Dr. Brand during my time at Grady over 10 years. We've had some long conversations about this and his helping to encourage us in the right direction with several of these programs. Before this, I will say one of the biggest challenges when I got to Grady, I've been there for about 10 years, was really just the facility. Right? It, in and of itself, demonstrated a disparity in care. Someone that you all are familiar with, Pete Carell, actually encouraged us to address women's really early in my time. And so we put about a $20 million investment into the prenatal area, the clinic, the diagnostics area, the family birth center. And then we've been able to improve just the women's and infants area and expand the NICU over that time. And so while that is if you haven't been in Grady, you drive by it, it's a monolith of a building that seems kind of maybe unapproachable from the outside, but on the inside, we have been working really hard to make it a healing, welcoming environment, and particularly for women and children. So many of the programs that we put together over the last few years really have kind of worked to target a number of the things that are on that first four of the list, recognizing that that the women that come to us for care need additional support often. And so one is the community health worker program, kind of similar to the mother resource, I think that was described in Dr. Dunlap's presentation. We have 2 community health workers that help moms. The initial idea was we have a number of women who come to us for triage. They may get their ultrasound, and then we don't see them again. Their lives are not organized enough to get into prenatal care. And so we've worked to have a community health worker program that's really a layperson who just helps moms get to those appointments, helps them on the journey to delivery with the goal, of course, getting to 40 weeks, and then helps them after that. So what are the things that new moms need to be doing, whether that's, breastfeeding or nutrition or anything kind of around of infant care. And so that's a small program. It is not funded by anything but grants, and we are kind of constantly working to ensure that it stays in place, and that reports through my team. Food is medicine. I'm going to show you a picture in just a second. This is for the whole hospital, but we talked about food insecurity. We screen all of our patients for food insecurity, and if they screen positive, particularly again in the OB area, they are given a prescription to our Jesse Hill Market, which is a partnership between the Atlanta Community Food Bank, Grady, and Good Measure Meal or Open Hand. And so through the Community Food Bank, patients can come and get boxes of food over a 6-month period, and then they have nutrition classes. We also have a teaching kitchen in the space, and so they can come and learn how to make the foods that are healthy. We have amazing stories of progress and kind of whole family change through our Food is Medicine program. Again, grant funded, all externally funded. This is one that even the board was like, can you really make these things work? Partnerships can be hard. But we have we've got continuous philanthropic funding. Our foundation has been very supportive. I'll tell you this, and the fun thing about Food is Medicine is, again, we've been on the Grady campus, we had a McDonald's, or partnership, or it wasn't partnership, it was just kind of a work with McDonald's. Nothing bad about McDonald's, but sometimes not the healthiest food. They decided to move on. So we were looking at the space, and the food bank folks said to kind of folks who knew me, this is that space right there. So to the left is the teaching kitchen. You see it's like a nice big space. And then to the back is kind of grab and go. And you don't see and hear the food pharmacy, which is back behind. But it's a cafe. It's just a healing space. And the reason I wanted to include this picture is, again, it's hard to understand the importance of beautiful spaces sometimes when you can't see them directly. But this is a beautiful healing space that our patients can come to, and it's for our employees in the community as well. But particularly for moms, being able to have this space for them doesn't look like a place you don't want to be. It looks like a place you want to be. But we were able to create this partnership kind of through the grapevine, and I got a lot of good work to say, we just need to make this happen. Still work to make it as effective as can we need more people in there, but the overall is great. Mobile integrated health is a part of my team as well. That's a part of our extension of our ambulance program, our 911 system. But we realized that we didn't have that follow-up with hypertensive moms, and sometimes they were staying in the hospital longer than they needed to be. It's time to go home and start their family. But what we do or you have their time at home, what we do with our mobile integrated health program is the physicians can make a referral into our program, and we send a nurse practitioner out to the home to measure their, to do blood pressure checks and understand kind of their postpartum needs. We've had a number of really good catches with this program. We just had a description the other day. A woman felt fine. They measured her blood pressure, and she was super high blood pressure, got her in the hospital right away, and she was able to be managed through that. Had she stayed at home and nobody knew what was happening, she didn't know that something was wrong, that might have been a different outcome. So we send this team to the home, and then they kind of can manage that overall. This is just funded through our operations. There's really not there's not a reimbursement for that. And then our centering program. This is kind of, unfortunately, not been as robust the last few years because of the pandemic. We're starting it up again, but it's been a proven approach to prenatal care through group setting, group visits for low-risk moms. And before the pandemic, most of these moms made it, about 90% made it to full term. So it's kind of creates a camaraderie and just a different approach to prenatal care that through group visits and education, and then encourages just that healthy environment before delivery. So that is our centering program, and we'll be starting that up again. In the paper, what you saw was what we have experienced since AMC was, I had done some projections beforehand to say, okay, well, if they did this many deliveries, and we'll probably get about maybe 50% of them. We got our volume went up. 50% of their volume. We thought it was kind of, most of them had prenatal care, but our ambulance volume, if you saw that in there, went from 2 a day to 6. That moms coming in to deliver, and then our neonatal volume went up about 40% just November 1st. It just happened like overnight in November. It's leveled off a little bit. December and January came down, but it's still much higher. And again, we're seeing kind of about 50% are not do not have prenatal care at rate. They could have it somewhere else, but because we don't have that information. But this has been, I think we knew trauma was going to be a thing. And we knew that over time we would see probably some changes just in the general population, people who were using that ED for just their general care. But the OB and then the NICU piece has been a bit of a surprise that we're all kind of working to get our hands around right now, changing our operating model to be able, we eventually can take care of it. We didn't have the staffing that next day to do that. So I think it is an opportunity for this community to work together in engaging in prenatal care and preconception care and prenatal care, using unique models to get to folks who maybe don't have that ability to get there in their day-to-day.
Wow.
Any questions?
Thank you. That's great information and good to hear. And we may ask you afterwards, what can we do to help out in that space? And Janet actually sent over some information just around health disparities. There's a couple of brief slides. As you can kind of see on this slide, we have kind of the median household income of the metro Atlanta area. You can see the 3 major county lines, with the darkest being the highest income zones. And then alongside it, the number of those that have health insurance, kind of mirroring that, and then showing where the population of color is separated. So just kind of frame you as we look then to also, as Shannon had referenced, the food deserts that exist within our city. Food deserts being classified as a zone where an individual could live and not have access to healthy food stores, grocery stores, shops within a mile of their home, and having at least 20% impoverished or low-income housing, which again similarly mirrors some of the graphs that we saw on that last slide. And then when we look at just a couple of negative health outcomes and the frequency that those, both cancer and mental behavior disorders, also similarly kind of reflects that. So we can definitely see the socioeconomic impacts leading to health outcomes. Yes, please.
So we have these maps because, well, we do this every 3 years for our community health needs assessment. And so it's online. You can go to Grady and type in. It's about a 120-page document that we pull together every 3 years. Every one of these maps is the same. So it's not really, it's that disparity in care, or that disparity in everything. That as we think about, as Esther said so eloquently last week, we've got to be able to get some, we need to think as a community about what is the resource that helps to get to that, to change these maps. And at the end of the day, there has to be some infusion of something. And Medicaid expansion, sorry, I've tried to say, not to say for a long time, but is that would help this. And I think as Dr. Brand has said in the studies that they've looked at, these are, you can study these like 1,700 different ways, and it's always kind of the same outcome. So
when we think about some of the other bullet points, number 9, closing the education gap, reducing poverty. Number 10, supporting working parents, enhancing coordination of family support. We have a community partner in Agape that we're already working with, doing a lot of work, and I'm going to ask Dr. Barrett to come up and speak to some of the ways that we can get involved with the community center. Good morning.
Thanks again to all of you for attending this class. You know, my life for 40 some years has been all about women. And I was just talking to somebody earlier when we walked in here. The awareness in my field about this subject has really skyrocketed, I'd say, in the last 10 years and really in the last year or two. And, you know, the question at hand for us is what can we do as a faith community? We've been given this subject, we've been given data, we've talked about it. And, well, a lot of us have a lot of ideas, but Dr. Lindsay, when he was here, really came to the idea, you know, he's been involved with the maternal mortality committee here on the statewide level. And believe me, from the national level, down to the state level, down to the local level, we hear what's going on at Grady. I know what's going on at my hospital. There's a lot going on. The awareness has really risen. But Dr. Lindsay's point was this is really a social issue. I don't think it's our job to tackle the medical part of this. I think that's being tackled. We can do a better job. We're trying to do that. And there are a lot of different entities at work with that. But as a faith, and you know, interesting, I was looking at some data about the insurance issue, which I do think Medicaid expansion in some form is something that we should strive for. But I looked at the data out of England, for instance, where they have national health, and the disparity in black-white is not much different than it is in this country. And they've looked at statistics, women that do have Medicaid coverage, women that do have commercial insurance coverage. There's still a disparity in this country when it comes to healthcare statistics, maternal morbidity and mortality. So obviously the insurance issue is a component, but it's not the whole story. What can we do? Well, there are a number of things here at Trinity. We support Buckhead Christian Ministries. And what I'm talking about by our support, obviously, is twofold. You can volunteer your time and your talent, or you can donate your treasure. And Buckhead Christian Ministries helps people that are in crisis and keeps them from falling into homelessness by giving them food support and rental support, and then financial assistance as far as their financial literacy. And it's a great organization. We've partnered with them for years, so that's one entity that we're already very aware of. I did mention my experience in Haiti. Haiti, the island of Loganoff, is one of our mission partners. And there is a Loganoff Haiti partnership, which Julie Hope has been very involved with that, and Barbara Irwin, and myself to some degree, Kurt Swenson, a number of people. So that's another place to get involved. The donations that go there and are funneled back to that island are used a lot of them for healthcare, and they are making a difference. And then finally, one that you all are aware of is the Agape Community Center. I currently chair the board there. I'm very well involved, or very well informed, for the most part, about what's going on. It's an incredible organization. It's been there for 25 years. It's gone through all sorts of changes. Nell Ben has been there for 20 years, and she is one of the reasons it's been so successful. But our mission there at Agape is to empower the families that we deal with to reach their full potential and to break the cycle of generational poverty that goes on in that area of town. And we believe, and that's come up in this class in a number of ways, that education, instilling hope, and really allowing these kids to thrive. The kids that we've been involved with, we serve about 200 kids a year. So, that's an exponential number as it goes up. You deal with the kids and their siblings get involved and the families get involved. Our graduation from high school, our rate is, COVID changed these numbers a little bit, but it's been around 80 to 90%. And you look at the Atlanta public school system and their rate is not nearly that good. And we also now are getting about 80% of these graduating seniors to go on to some type of technical training or college. And the other ones, we help them get a job. And so, again, these kids and these families are given a hope and a pathway and a realistic feeling that they can make a difference with their lives. And it's really an incredible thing to watch. These kids get up and they talk, and you're just blown away by this young woman talked last at some meeting, and she was, her family is from Mexico, and when she was about 9 or 10 years old, her mother got deported back to Mexico. Now, you're listening to this story, I don't think any of us could understand that in this room. And it was a real tearjerker, believe me, I'm getting emotional talking about it. And she went to live with a relative, she and her, I think, one sibling. I think her mother eventually made it back to this country, but it was years. Now, this girl has gone on and graduated from high school, she's in college, she's got a plan. I went up and talked to her. She wants to get into social work, but criminal defense, something in that arena, not an easy job choice. And I said, wow. But she's committed. She probably will do it. And Agape gave her the resources and the hope. And so, anyways, it's how do we get involved at Agape? Well, obviously, no one's going to turn down your checks. We support them through this church. We give around $200,000 a year. But we have a lot of us in this room and a lot of us at this church give individually also. So your treasure is more than welcome, but your time is very welcome and needed. And we have a program in the afternoon, Monday through Thursday, where you come and mentor kids and you help as a homework buddy, tutor, however you want to spend that hour. And it's extremely helpful for these kids to show them kind of the other side of life and show them that somebody else cares for them. So that's basically my story about how I think we as a faith community can get involved. Thank you.
Thank you, Dr. Barrett. Next, I'm going to ask Velma to come up and speak a little bit about the interfaith collaboration.
Thank you. First of all, Peter, were you talking about just using Scott Elementary as well?
Oh, yeah, I forgot to.
Oh, I'll mention it, no worries.
Yeah, please do.
Okay, thank you. As I was listening to the countdown of the 12 again, and we got to 12, which is undo racism, I thought, that's mine. But I can't do that, obviously. None of us in here can do that individually. Sorry.
But are y'all familiar with the story about the sand dollars on the beach?
Yep.
Y'all know that. And everybody know it? All right, if you don't know it, I'm gonna tell it anyway, I'll tell it quickly. A granddaddy and his grandson are walking on a beach and they see all these sand dollars that have been thrown in by the tide, but the sun is coming in. And these are live sand dollars and the sun is coming up and they're gonna die because the sun will kill them. And so the granddaddy starts picking them up one by one and throwing them into the ocean. And the little boy says, why are you doing that, granddaddy? And he said, because they'll live. I'm going to throw them in there because they'll live. And he said, but look at the beach. There are hundreds of them. You can't save them all. And he picked up another one and he threw it into the water. He said, what you do, how can it matter? And he picked up another one and he threw it in and he said, it matters to this one. And that, we tell that story in the juvenile court system because when you hear about all of this, when you hear about the massive nature of this problem, and certainly the massive nature of racism, you think, what can I do? Well, we can do something, and we do have a collaboration, which is what I'm supposed to be talking about. And Agape has expanded to Scott Elementary, which is primarily a Black school, correct?
Yes.
Remember what Brian Stevenson told us? He said, get proximate to people. So if we go over to Agape, if we go to Scott Elementary, and we are tutoring or mentoring a young child, we're proximate. And just as one of the doctors said, and it's said over and over again, it only takes one caring adult to change the trajectory of a child's life. And it doesn't mean you're buying them stuff. It doesn't mean that. It means you are supporting them. One caring adult, never forget that. I tried to be the one caring adult in my courtroom for kids that seem to have no caring adult in their lives. I'm not saying I did it. I'm just saying I tried. And so Agape, obviously, with Georgia Justice Project, we have many opportunities again to get proximate. And the things we do when we go down to the Metro Reentry Program, and we are taking surveys of those young men that are about to get out, enter our community again, we want to be sure that they're able to get jobs so that we're lifting them out of poverty. We're lifting their families out of poverty so that we don't have to have this go on. And it makes a difference as we're sitting at our little table and a young man in a white suit comes in with a blue stripe down. When we stand up and we look him in the eye and we shake his hand and we say, hi, my name is Velma Tilley. When you give people dignity, it makes a difference in their lives. It's another, as you'll hear in the sermon again, you're planting a seed, or you may be watering, and then God brings whatever growth there is. So the other things, those of us who are lawyers can help clients get their records restricted. Again, that helps people get jobs. People who are either lawyers or not lawyers can go do parole and help them write parole applications. If you're good with words, unlike me, like Shannon, very good with words, you can volunteer to go down and hear what their story is, and you write it up in a way that the parole board will pick them out of the other 500 applications and say, yes, you're worthy of a parole. And then we work on getting that record restricted. So people, you can't get parole if you've been in trouble in the last 5 years. So we're talking about people who are changing their lives, and we want to be a part of that. We're partners with Ebenezer Baptist Church, with the Temple, with St. Luke's, and hopefully doing a bailout. You know, if you're in jail and you can't make your bail, you haven't been convicted of a crime. It may be the first time you've been in jail and you're sitting there, you just lost your job. Your kids may be heading to foster care because you can't make bail. We may participate in a bailout project this year for Juneteenth, sorry. So be thinking about that. Policy advocacy. You're talking about policy advocacy or mine?
John.
All right, so I'll stop talking. But those are the things. We actually are doing things. So join us down at the Capitol when John tells us all about it. That's it. Thanks.
John, do you want to speak a little bit to advocacy and opportunities?
Good morning, everybody. First of all, I want to, like Peter has, I'd like to thank you all for attending and investing your time, and particularly for listening. One of the things that I've learned through this is that my family has a pretty powerful story, but each one of you has a very powerful story. And we are uniquely positioned in this church in this neighborhood to really advance the ball with advocacy. Because many of us are the ones that are writing the checks, that the politicians are calling, that they're sending emails, and they, like it or not, they will listen to people that give them money. And so when you are engaging with a political person, particularly elected official, take a few minutes and tell your story as it relates to healthcare and it relates to, particularly the women in your life, those that you love. Up here, two examples of things that we can get them plug in right away. One's right around the corner, which is on Wednesday at 7 p.m. And it's a webinar, so you can do that from home. The other is an advocacy day at the state legislature, and that tells it as well. And I think getting involved in that is great, but it also is just day to day. It's awareness. Philosophically, I tend to come at things from a if somebody says the government should do this, I'm thinking, well, is there another way around it? And I've really thought and looked at this whole issue of expanding Medicaid, and I really believe that there's a strong business case for why it's a good investment. If you spend much time in NICU or an ICU, and you see how many hundreds of thousands, some cases it's 1 million or more, get spent in situations that could have been prevented, but for there was not care prior to pregnancy, there was not care during pregnancy, and the woman shows up, and those in the medical profession, shows up and delivers the baby, and then there's a serious problem. And sometimes you can do all the right things. That's certainly what happened with Mary Holmes, and you have those problems. Well, let's save that space for those babies and those children, and then let's figure out how to do that. But this is a long-term problem. It's a complicated problem. Nobody has all the answers, but if our heart is in the right place, and I know it is with everybody in this room, we can make a huge difference. We just need to tell our stories. Thank you.
Okay, so every Sunday, we've been hearing how fortunate we are. And when Alan and I started working on this class, I remember the thing he said to me that I knew, but it just was so pithy, is so much depends on zip code, where we live and what we bring to what we have in our lives. And there's a trendy term out there now. What is your superpower? And our superpower, I don't need to tell you this, our superpower is we are educated. We are in a place where we get continuing education at this church. That's been our goal with the Adult Ed Committee and the whole church. We have an environment that is comfortable, that is lovely, that keeps getting lovelier thanks to Esther and all this technology that we have to send our message out into the world of people like Cecilia Gardner, I think who lives in Boston or something. Anyway, we have so much. And this is not to make us feel guilty. This is to make us feel empowered. And so giving of our talents and treasure, Rebecca, there she is in the back. She said this in a sermon 2 or 3 weeks ago when she was talking about the Beatitudes. We are blessed to do this work. That's what we should feel. Not guilty, but blessed to do this work. And so obviously there's financial support, and you've heard all these different ways that we can, them. We don't have to tell you. You know all the different ways. Giving to the food bank. I mean, did we see today how giving to the food bank could be a major event? Agape, all these other institutions and initiatives. We've just got a list here. It's a beginning list. If you can just run your eyes across it for a second. I will tell you, there was an event at Trinity this week, where a woman from the organization Motherhood Beyond Bars came and spoke to us. And I will say that I went into the event knowing that I would be asked to write a check, and I had my amount in mind because I'm trying to give to all these different things. And after she finished presenting, I doubled my contribution because it was so powerful about what this organization is doing for women who are incarcerated. And I wish you could have offered the story. It's amazing. And these are our fellow men and women. And so